There you go.
When DENBIGH Shelton, an employee at the Health and Human Services Commission, returned to work after giving birth to her first child, she was allowed regular breaks to pump breast milk in a private room at her office. But many working mothers, including school teachers, are not offered the same accommodations.
I think it's important for working mothers to feel like they can go back to work and have that support. It's a really hard adjustment, and I think any barriers that can be reduced is really beneficial.
As of September 1st, a new state law will guarantee that all public employees, including state and county workers and public school teachers, are allowed reasonable accommodations to pump breast milk in the workplace. Those include sufficient break times and a private room, such as a single-person bathroom where employees can pump. Federal law already requires employers to provide accommodations for hourly employees, but they don't have to provide those accommodations for salaried workers.
Our thinking was they shouldn't have to decide from nursing their newborn baby and not being able to go to work and not having the same accommodations that we already provide for hourly employees.
Requiring regular breaks for public employees to pump will help working mothers avoid experiencing reduced milk supply, says CAROLYN PUTNAM, a lactation consultant in Austin.
Their milk supply can diminish if they're not expressing frequently enough, and it can lead to discomfort, pain, and even infection. It's a public health issue, and it's a individual health issue.
State lawmakers had been unsuccessful in previous years in their attempts to close what they call a loophole that leaves some female employees without protections to pump in the workplace. This year, the measure picked up bipartisan support from the legislature, but ran into some opposition from Senate Republicans. WALLE's original proposal, which mirrored federal law, would have required employers to provide breastfeeding moms with a private room other than a bathroom to pump. But Republicans amended the measure to ensure that the legislation did not open up public employers like state agencies, local governments, and public schools to lawsuits over the accommodations, and made single-person bathrooms an acceptable accommodation.
I don't think that's too sanitary, and I don't think mothers should have to pump in the restroom. And so that gave me a lot of heartburn, to be honest with you.
But WALLE and advocates for more protections for working mothers are hoping to tackle that in the next legislative session. Reporting for the Texas Tribune, this is Alexa Uda.